Good morning, good afternoon, good evening to everybody joining us for this COVID-19 press briefing from Copenhagen here at the UN City in Denmark. Very happy to be joined today. We're joining you also from Athens, Greece, where our Regional Director, Dr. Hans Kluger, is on an official visit. It's also a great honor to be joined today by Dr. Vasilis Kikilias, the Minister of Health of Greece. A very warm welcome to you, sir, and thank you very much for joining us today. It is truly an honor. Before handing over to our Regional Director, Dr. Kluger, let me also explain who else is on our panel. Also over in Athens, we have Dr. João Breda from WHO, our Senior Advisor at the WHO Athens Quality of Care Office, which we'll hear a little more about shortly. To my left here, I'm very pleased to be joined by Dr. Catherine Smallwood, who is our COVID-19 Incident Manager here at the WHO Regional Office. We're also joined by Dr. Siddhartha Datta, our Regional Advisor on Immunization, also here from Copenhagen with us at WHO Europe. So with that, I'm going to hand the floor over to our Regional Director, Dr. Hans Kluger, to say a few opening words.
Thank you, Rob. Good morning and good afternoon. Among the silver linings of COVID-19 is the fact that it has emphasized the urgent need to ensure equitable access to healthcare. This morning, I had the pleasure to open with the Minister of Health of Greece, Dr. Kikilias, the WHO Athens Quality of Care Office here in the capital of Greece, hosted by the Greek authorities. The center will serve the needs of the countries of the southeastern part of the WHO European region and the Mediterranean basin, focusing on technical assistance, support and leadership on quality of care and patient safety. This is an enormous milestone for Greece and for WHO, as well as for the millions of people who will benefit in the coming years. Before moving on to COVID-19, underlining that we cannot take our eyes off other health threats, later today, WHO Europe is launching a landmark report on the current trends of alcohol consumption, harms and policy. Last week, we surpassed 1 million confirmed COVID-19 deaths in the WHO European region. The situation in our region is serious. 1.6 million new cases are reported every week. That's 9,500 every hour, 160 people every minute. It is only among the oldest that we are seeing declining incidence. Over the past 2 months, the trend among people more than 80 years of age has diverged from the trend seen in every other age group, possibly thanks to high vaccination uptake in this high-risk group. Since February, the proportion of COVID-19 deaths in Europe among those older than 80 has gradually fallen to close to 30%, the lowest level since the beginning of the pandemic. Hospitalization nonetheless remains at high levels, with continued reports of intensive care capacity having been exceeded from all parts of the region, also in Greece. This April, COVID-19 admissions to hospitals and intensive care in France reached the highest levels since this time last year. There are early signs that transmission may be slowing across several countries. But let me be clear, early signs of decline are not equal to low rates of transmission. Transmission must be driven down to low rates and kept low by harnessing our energy and resilience to beat the virus. The availability of all public health and social measures is critical, including the rollout of vaccines. Adjusting social measures must be done not based on vaccination targets, but on the basis of epidemiology and the ability of our health services and workforce to cope with COVID-19 and to maintain basic public health services. Safety is paramount. Globally, there there has been a very small number of cases of rare blood clotting disorders among the 200 million people that have received the AstraZeneca vaccine. WHO takes safety events extremely seriously, and our Global Advisory Committee on Vaccine Safety and the Strategic Advisory Group of Experts on Immunization continue reviewing the evidence. WHO will provide guidance to member states shortly. We urge member states to report any adverse events that may occur following vaccination as early as possible. For now, the risk of suffering blood clots is much higher for someone with COVID-19 than for someone who has taken the AstraZeneca vaccine. Let there be no doubt about this. The AstraZeneca vaccine is effective in reducing COVID-19 hospitalization and preventing deaths. WHO recommends it to all eligible adults to gain protection from the SARS-CoV-2 virus as quickly as possible. We are also aware of reports of thromboembolic events with low platelets following vaccination with the Johnson & Johnson COVID-19 vaccine. WHO is monitoring these reports closely and will communicate its findings in due course. To date, some 171 million doses of 7 COVID-19 vaccines and products have been administered in the region. Nearly 13% of the European population have received one dose, while close to 6% have completed their series. In Greece, where now 1.6 million people, or 16% of the population, have received at least a dose, while 7% is fully covered. And I congratulate the Minister and my Greek counterparts on their extensive preparations to ensure that the country was ready to effectively receive and deploy vaccines. As part of the European Union, Greece has demonstrated solidarity by supporting COVAX, acknowledging that the economy and prosperity of one country is intricately bound to another country's prosperity, and in this case, bound to defeating the virus. Equity within borders is very important. It's not only about equity between countries, it's also about equity within a country, making sure that vaccine access and utilization does not further marginalize the underserved. Here, Greece has led by example. The country's entire refugee and migrant population, more than 100,000 people, are part of the national vaccination strategy, as they should be, alongside the general population. Congratulations, Mr. Minister. Mass vaccination campaigns in Greece's refugee camps are scheduled next month. Once again, only vaccinating a chosen few and excluding population segments undermines our fight against the virus everywhere. Before handing over to the Health Minister, I'd like to thank the Minister for the warm welcome and for your leadership and resilience in the past months. To those marking the month of Ramadan, I wish you and your loved ones a blessed holiday and urge you to celebrate safely. Ramadan Kareem. Thank you.
Thank you very much, Regional Director, and thank you for joining us from Athens today. Alongside you, we have Minister Kikilias. And sir, I would now like to pass the floor to you to say a few words. Thank you very much. The floor is yours.
Thank you very, very much. Good morning and good afternoon from Athens. I would like to say that it's a great honor for us to have the WHO Europe online press briefing being held from Athens today. In fact, this press briefing comes on a very important occasion. Dr. Kluger already mentioned the creation in Athens by the WHO organization of the first ever quality of care and patient safety office in the world. Moreover, I would like to thank WHO Regional Director, Dr. Hans Kluger, and the entire WHO Europe team, including the WHO country office in Greece, for their fruitful collaboration, their immediate and direct line of communication, and the excellent outcome we have today with the establishment of this new office. I would like to congratulate my colleagues at the Hellenic Ministry of Health who have tirelessly worked under difficult circumstances, COVID-19, since December 19, when Dr. Kluger first visited me here in my office in order to discuss the implementation of this initiative of global eminence. Who could have anticipated, dear Hans, back then that a few days later the coronavirus pandemic would break out, which continues to take the planet by storm even today. Today we are launching a new monumental chapter for the history of Greece, but also for the history of the entire European region. So why was this office set up in Greece? The criteria set forth by the World Health Organization itself were the following. First, the political commitment demonstrated by the Hellenic government and the Ministry of Health, more specifically to promote robust landscape public health and health system transformation. A prime example of this is the launch and implementation of the anti-smoking law in Greece more than 10 years after its initial announcement. An emblematic reform which has improved our daily lives. Second, the significant knowledge and experience gained by Greece in the field of quality of care and patient safety through the legislation and the establishment of the National Organization for Quality Assurance in Health, ODP. Third, the unique features of our country which can protect health and improve quality of life, an element that has not been taken into account in the quality of care models. I think that we all know that Greece, with its record of longevity and its trademark Mediterranean diet, for instance, can set the example for how to improve quality of life in Europe. And of course, the resilience shown by the national health system in our country during the current unprecedented health challenges of the COVID-19 pandemic. And regarding the pandemic, I would like to point out, my friend, Mr. Director, that the national health system of Greece has endured, endures, and will continue to endure. We have drawn up an emergency plan which we are implementing, and our healthcare professionals have been working tirelessly for the past 15 months to protect human life. I want to take the opportunity to thank them, this floor, on this historic occasion, for their immense sacrifice and for the service that they are doing to their country and their fellow human beings. Greece, I think, has proven that it has a huge comparative advantage over the health systems of other countries with much better infrastructures and much more advanced management systems. The biggest advantage is that the people of Greece can make the impossible possible, even enduring the most unprecedented public health crisis of the last century. That, even under conditions of pressure and peril, they work tirelessly day and night and work together successfully. Top of the pyramid to the base. That in coordination and based on a plan, which I have been prepared from the first day we have been able to work tirelessly for the supreme gift, the gift of health and human life. So once again, thank you very much for being here. Thank you very much for your leadership. We cherish WHO and our partners, WHO Europe, and we strongly support your initiatives and your leadership within the crisis and in all health matters.
Thank you very much indeed, Minister Kikilias. Thank you for those opening words, sir. And I'm going to now open the floor to our journalists. Thanks again to those of you that have sent your questions in advance. I'll be interspersing these throughout the press conference as best I can. But let's go straight over live to Gunilla van Hol at Svenska Dagbladet in Sweden. Gunilla. Gunilla van Hol.
Yes, sorry.
Yeah.
Can you hear me?
We can. Please go ahead.
Yes, I'm sorry. Look, I have a question on Denmark. In the world, I believe yesterday to stop using the AstraZeneca vaccine because of the potential link to the blood clots. Is this a reasonable decision? Are you worried that this will do more harm than good? What are they expected to do with their vaccine doses? And what are your concerns that this will affect the general vaccine rollout in Europe if other countries follow? Also considering that Johnson & Johnson vaccine has now been delayed over similar clotting concerns. Thank you.
Thanks, Gunilla. Now we have, of course, João Breda, we have Catherine Smallwood, and we have Siddhartha Datta on the panel, just to remind you all. So I'm going to go to Siddhartha Datta with this question. Siddhartha, please.
Thank you so much, Rob. Thank you, Gunilla, for your question, and I hope you hear me well. We are aware of the decision made by the Ministry of Health of Denmark on the cases of the decision made to suspend the use of AstraZeneca vaccine and had been taken out of the vaccination COVID-19 vaccination program. Just wanted to highlight a few things which you outlined. One, the detection of these rare cases of safety events in a country outlines the mechanism of vaccine safety monitoring which is existing. I think we have to acknowledge that these safety events, monitoring, reporting, investigation is important. Other part is that these vaccine safety events, communicating it to the population is extremely important. This transparency is extremely critical to instill trust in the population on the vaccine use. We are at the very early part of the COVID-19 vaccine rollout. As we go into the further steps, these activities by the Ministry of Health is extremely critical to instill the trust. The countries, not only Denmark, but any of all our 53 member states, would have a system in place so that they can monitor any of these safety events and then make a decision. The countries are sovereign to look into their own data and then make a decision. And we are keen to learn from Denmark into this whole process on their investigatory results and thereafter. Thank you, Rob.
Thanks very much. I'll also go over to Katie Smallwood to add a few points on this. Thank you.
Thank you very much, Gunilla. And just to add to what Siddhartha said, I think it's important to look at the epidemiology in Denmark. And I think that has been a key factor in the announcements that Denmark has made. Denmark has had an ability to bring down cases to really controlled levels, has widespread testing, and has a testing positivity rate of significantly under 1%, which means that Denmark feels quite confident in its current ability to control COVID-19 in the country. And has brought down case levels really since the beginning of the year. So I think that's something that really has to be made very specifically in the context of any discussions around Denmark and its decisions around vaccination. Over. Thank you.
Thank you both very much. Thank you very much, Gunilla. I'm next going to go over to John Goranitis from Inside Story Greece. John?
Hello from Athens. Thank you for taking my question. Dr. Kluger, exactly 1 year ago, it was April of 2020, I have asked you regarding the idea of using immunity passports in order to reopen the economy and especially sectors like tourism. I don't know if you recall it, but you weren't keen on that idea back then. So I'd like to repeat the same question, but this time regarding the digital green certificate. Do you support the EU proposal? Are you worried that countries like Greece, that is opening up for tourists in mid-May, could face a resurgence of cases? And Dr. Kikilias, do you share the concerns regarding tourism? And if I may, one more question, please. Given your experience during the past months with the epidemic in Greece, could you point out one or two things that you would have done differently, or certain mistakes or decisions that you wish to have taken or not taken? Thank you very much.
Okay, thanks very much, John. There were 3 questions there for the regional director and for the minister, and I'm also going to ask Katie Smallwood to chime in on your first of your 3 questions as well. But first, I will send this over to Athens, to the regional director to respond regarding the certificates, and then to the minister who sat alongside him.
Yes, John, absolutely. I remember very well, because this was a train which was going forward and not to stop. So a number of points here. It's extremely important that we have a documentation of the people who are vaccinated, right? To have an idea of the vaccination coverage, of the vaccination effectiveness, and ideally in the digital era, to be, as the EU is proposing, a digital certificate. But not only the EU is coordinating this with WHO globally so that the standards are uniform. But there is a difference, of course, between a certificate and what we call a passport. So WHO is currently examining the political, ethical, and legal aspects, because what we would not like to see, obviously, is that whatever measure is increasing inequities, and especially not that in scarcity of vaccines, people who travel would be prioritized above the ones who are most exposed, which are healthcare workers, and the most vulnerable, which are elderly people or people with comorbidities. So in other words, not as a condition, let's say, which may lead to increased inequities. But what we are working now on as a WHO globally is what we call an international framework of trust. And that's very important. And absolutely that the people should have a digital, at least, certification. Thank you.
Thank you very much, Regional Director. Minister, did you catch the other two of John's questions? If so, I'd like to hand you the floor. Thank you.
Thank you very much. The first question was about tourism. Tourism is a heavy industry in Greece, and for many, many other countries, also in Europe, especially in the Mediterranean Sea. Well, last year we had no vaccination. So that was not a weapon on the table. And we still managed to organize a high quality and organization system with healthcare units in small islands, larger islands, hospitals, transportation, and extreme testing in order to be able to cope with more than 4 or 5 million tourists that visited Greece. So we're very, very optimistic that this year, with vaccination, with more capacity in testing, you've already seen we do every day more than 60 to 70,000 PCR tests and rapid tests. Now we've got a new weapon also, self-testing. We are confident that we'll be able to organize our tourism season with safety, be transparent about it, and make everybody feel confident in order to be able to visit Greece. People that work in the tourist sector and all tourists from all over the world that want to travel to our country. About mistakes or things that we would like to do in a different way, well, this is a non-constant fight. Day and night, a minister has to think, what did he do wrong? What he could have done better? I think speed and the safety of the patients is a main concern of a minister. Speed of vaccination, speed of organizing a healthcare system, and safety of all the citizens. So it's an ongoing procedure. Of course, we didn't do everything the right way. But I can reassure you of that. To the best of our abilities, we fought and we keep on fighting day and night in order to be able to help civilians organize a healthcare system for a huge pandemic. And I think the results are reassuring. But I have to say one thing and close with that people losing their lives all over the world and in Greece, it's not a statistic for me and us. It's something that we deal with a great pain. It's every death, every people that is lost in an ICU bed, it's not a statistic for the country. It's a mourning procedure and a great respect to the family and to the people that we have lost, and the lesson of what we can do next time in another big healthcare incident, or hopefully not close to have another pandemic, but what we can do to improve our systems here in Greece, in Europe, but I think, Dr. Kluger, all over the world.
Thank you very much, Minister. Now, we have a few questions that have been sent in advance with regard to the Office on Quality of Care that has been opened today in Athens. We have questions from Vasiliki Angoridi from News for Health. We also have a question from Sophia Christou, healthcare reporter in Greece on the website INGR. And then Maria Niki Goraganta, excuse me for my poor pronunciation, from the Greek newspaper Eleftheros Typos. And I believe we can maybe couple these questions together, first for the Minister, and then to Dr. Kluger and Dr. Breda. So, Minister, a couple of questions here. I'm going to try and do them justice. Could you, the question is, what are the benefits of having the centre located in Athens for Greece and the country's health system? And I think the related question here is, why was Athens selected for the establishment of WHO office? What are the criteria that make the Greek capital a strategic point for public health? So, Minister first, and then I have a follow-up question that I would then put to Dr. Kluger and Dr. Breda. Minister, please.
Well, in my opening statement, I talked about the criteria, of course, the political will, the proof that we can organize a healthcare system sustainable to the virus and up to new challenges. And of course, the basic idea is that do we only have to talk about volume, about quantity, or when it comes to healthcare systems or public health, we should talk about quality of health? Because I feel and we feel that in an unequal world, we should seek constantly equal opportunities for our people to get quality healthcare. So this was the basic idea. We're very, very happy to see that we met the criteria of WHO and WHO Europe. And we seek a partner not only for us, but all the neighboring countries in order to be able to exchange information, scientific criteria, to help physicians and NHS workers improve themselves. We have a high quality working capacity, doctors, nurses, and all the healthcare workers. So we seek to get better day by day, week by week, and offer better and more quality healthcare services. This is the basic idea, and I think that is well deserved for everybody in Greece and everybody in the world.
Thank you, Minister. A follow-up question from Vasiliki Angoridi from News for Health for the Regional Director, and then I will also go over to João Breda on this. Could you give us some practical examples on how the new centre of the WHO could help member states implement better policies for quality of care and patient safety, and which areas are in dire need of support? Regional Director, please.
Thank you, Vasiliki. So as the Minister was telling, this office is going to fill a major gap, because when we speak about universal health coverage, we often speak about access to health services in an equitable way without financial impoverishment. But obviously, what the people need are quality health services. Globally, about 8 million people die each year due to poor healthcare, with patient safety events and enormous economic costs. So it's really a win-win situation. It's about providing the right care at the right time, and now we speak more and more also in the right setting, the appropriate setting. And some concrete examples, taking into account also the COVID-19 pandemic lessons learned, which we discussed with the Minister this morning, is the development of a framework to assess the quality of care. Right? So data is power. We need to assess quality of care honestly, and then link it with digital services. Second is that the office will be a hub for innovation. That's a main function that WHO is doing. It's exchange of very practical know-how, not only on the what, but on the how. And countries are doing amazing things, but we need to bring it together and be a real hub for innovation. And again, Greece has a lot to showcase here. And third then is to develop practical tools so that countries can take these generic tools and adapt it with or without WHO support to their own context to ultimately increase the quality of care. Thank you.
Thank you, Regional Director. That seemed like a very comprehensive response, but I'm still going to invite Dr. João Breda, who's with us on the panel today, in case he has any additional points he'd like to make. João?
Thank you very much. Just to add that this office will also open avenues of work in terms of quality of care, linking up with mental health, with primary health care, with healthy aging, building on the excellent expertise that we have, of course, in Greece, but also elsewhere, and a focus on sub-regional approach and a focus on countries like it was said before in the southeastern part of the region and also along the Mediterranean basin. So very excited with this opportunity. Thanks very much to Greece.
Thank you very much for those responses. Next, I'm going to go over to Jamie Keaton, who's joining us from the Associated Press. Jamie, welcome back.
Can you hear me?
Jamie? Yes, we can hear you now. Please go ahead.
Thank you very much. This is for Dr. Kluger, if I could. Dr. Kluger, we mentioned, you mentioned recently that there were some concerns about the slow pace of vaccination in the European Union and in the European region. And I'm wondering if you could address the concerns about vaccine hesitancy in the wake of these troubles for or concerns about AstraZeneca and Johnson & Johnson. And if I could just follow up on Gunilla's question earlier, what do you recommend to the governments of some countries, including the one in which WHO Europe is based, that have decided not to use the AstraZeneca vaccine, but are holding on to the doses that could be used in other countries that may want them? Well, what do you recommend to countries like Denmark and others? Thank you.
Okay, thank you. Thanks very much, Jamie. I go to the regional director, and then I'm going to go to Siddhartha Datta with the response, please. Regional director.
Jamie, good to have you back. And first and foremost, as you somehow hinted yourself, right? When I made the statement, I was speaking about, as always, the pan-European region, the 50 European member states. And this was not a criticism of any kind, but it's a statement, because we do have now tools which make that COVID-19 is a preventable disease, and we have the fast spread of variants of concern, and, as you mentioned yourself, pandemic fatigue, which in a number of countries became even violent pandemic frustration. So in that sense, everyone has to really work together to scale up the pace, recognizing that a lot of very positive things are happening, including, for example, as we discussed with the Minister of Health this morning, one of the silver linings is the joint procurement by the European Commission, which we all agree is something that is quite impressive, taking into account that this is a bloc of 27 countries. But of course, we need to see this now pan-European, which comes back to your question, for example, on if a country, one of the strategies is donations or reselling instead of hoarding. And I did have this conversation with Dr. Søren Brøstrøm, the Director General of the Danish Board of Health, yesterday, that I understand the Ministry of Foreign Affairs of Denmark is ready to, or looking already into options for sharing AstraZeneca vaccines with other countries, which is the recommendation that we had before this Denmark made a decision, and definitely now. And I would like to express my appreciation for this to Denmark. On the pandemic fatigue and frustration, indeed, this is nothing new. We are measuring this with repetitive surveys together with the Minister of Health and Public Health Institutes in 30 plus countries, including in Greece, then to co-design strategies tailored to the communities. We have to know the people perceptions, right? And not just point the finger, because I do understand, and also from family and own situations, that this is a tough situation and people are legitimately tired of the situation. We have suggested in our actionable policy framework 4 key strategies for governments to address fatigue. The first one is understanding, and that's why I created the unit on behavioral and cultural insights with human sciences, anthropologists, sociologists. We have to understand, right, what's in the mind. Not think, but understand. Number 2 is engaging. And engaging with what I call champions in the community. And there are many, many good examples. Can be different people from the sports world or from influencers. The third is what we call allowing space to live. We have to live our lives and we have to allow that space to happen. And fourth, something in fact we discussed again with Dr. Kikilias this morning at the opening of the office, is empathy. You know, in the Greek ancient history, this is a very important notion. Empathy. We need visionary leadership. We need hope and optimism because there is light at the end of the tunnel, which unfortunately is a bit longer than we thought, but the light is there.
Thank you very much, Regional Director. Siddhartha Datta, maybe to elaborate on the vaccine hesitancy element of that question. Thank you.
Thank you. Thank you, Jimmy, for your question. So to highlight on the vaccine hesitancy part of it, just to say that any safety events, people may have concern, as you have heard the regional director also has mentioned about it. But I think it's extremely important during this process that we understand the vaccination uptake in different age groups, different population groups. So that number is extremely important. Data should guide us what the policy consideration should be. When we look into the data, a lower uptake in any of these population groups, we need to start looking into the drivers and barriers of the vaccination uptake. Hence, once we get the knowledge about these, then the tailored plan in each of the communities, in each of the population group has to be outlined by each of the member states so that the vaccination coverage can improve. Vaccine hesitancy should also be seen as a perception of the population to understand better what is happening. And in this regard, the efforts made by the member state to be transparent in sharing this information out will be extremely critical to instilling the trust in the population group. One other factor is within this perception should be also be considered as a health-seeking behavior of the people for the informed decision-making process. So I think these all need to be looked into in a capsule and shouldn't be seen in silos. Thank you.
So, Siddhartha, while we're on this topic, Oskar Gozinski, journalist from the Polish press agency, referring to the AstraZeneca vaccine, similar problems with Johnson & Johnson one. On Tuesday, the FDA has decided to pause the use of it, pending further studies. His question is, should Europe consider pausing the rollout of these vaccines as well? Siddhartha.
Thank you so much. Thanks, Oscar, for that question. As you have heard, Regional Director has mentioned, we are aware of the decision made by US FDA on the pause of this vaccine. What does that mean? This means that there is a safety monitoring mechanism in the countries to detect these rare safety events, adverse events that has following immunization. This also indicates that every member state, including WHO, considers vaccine safety as one of our priorities. We continue to monitor that and these events, and including all other events that are happening around the use of Johnson & Johnson, AstraZeneca, and also for other COVID-19 vaccine. WHO is engaged with these regulatory agencies, including the European Medicine Agency, to understand better these rare side adverse event that has happened. This is extremely important that any decisions that are made by the country or WHO is based on the better understanding of these rare events. And then a benefit to risk assessment is done for each of the population groups, each of these age groups that are being affected. The benefit to risk assessment is extremely critical and important because this is public health emergency which is happening across the globe. The response has to be global. However, the local considerations, as you also have heard Dr. Smallwood making a reference earlier, this local disease epidemiology to the risk is an important aspect, and WHO will continue to provide the guidance to its member states. Thank you.
Thank you very much, Siddhartha. So next, I'm going over to Penelope Lirsch from Feature Story News, CGTN. Penelope. Welcome.
Hi, hopefully you guys can hear me. Thank you for taking this question. It's on vaccines. I know WHO is constantly evaluating many vaccines from all around the world when it comes to COVID. We're just wondering, is there any update on two of the Chinese-made vaccines, Sinopharm and Sinovac? We understand there might have been an update coming in the coming weeks. Can we hear anything more on that? Thank you.
Thanks very much, Penelope. I'm going to go back to Siddhartha. Thank you.
Thank you, Penelope, for your question. Yes, indeed, the WHO's emergency use listing mechanism is an established process in WHO headquarters, wherein the pre-qualification team of WHO reviews the clinical trial data submitted by the vaccine manufacturers, including the good manufacturing practices of the vaccine production nodes or sites that we say, including the clinical data that comes through. For the Sinopharm and Sinovac, we are in touch with them to review the dossiers that have been submitted by both the vaccine manufacturers, and that process is ongoing as we speak, and we will be hearing about the decision on the emergency use listing in April or early May. So please keep an eye on the pre-qualification page of WHO's website and for further updates. Thank you.
Thank you very much, both to Penelope and to Siddhartha. Next, I'm going to Konstantin Ionatashvili from Rustavi TV2 in Georgia. Konstantin.
Thank you. My first question is for Minister Dr. Kikilias. Months ago, when President Charles Michel was in Georgia, he mentioned about the possibility of helping Georgia to get vaccines. Do you think European Union could help Georgia as an Eastern Partnership country to get vaccines, except only through COVAX platform? And the second short question is for WHO representatives. Currently in Georgia, there is a lot of speculation about effects of COVID on fertility. Could you please explain if COVID disease or COVID vaccine have any impact on the male or female fertility? Thank you very much.
Thank you very much. So I'm going to go over to Minister Kikilias, first of all, to answer your first question. Thank you.
Thank you. Well, I think that the European Union has shown solidarity through the COVAX mechanism, and member states have declared that since on the ongoing procedure of obtaining vaccines, all the member states will probably have more vaccines than needed gradually within the year 2021. Then we will shift to the mechanism or even donate straight away vaccines to other needing countries. So I think solidarity is there and the help is there. And also there's a route to which we can all together follow and help countries in need. Thank you.
Thank you very much. We will now. I will also go to Siddhartha and then to Katie on the second question that you put to us. Thank you very much.
Thank you so much. In terms of the COVID-19 vaccines effect on the fertility of both either women or men, the current evidence doesn't suggest any such. So the use of the COVID-19 vaccines, both in the clinical trials, did not show any adverse effects on the fertility of either women or men. So for additional information on these, we request you and the listeners to be directed toward the WHO's repository on the COVID-19 vaccine in our website, which got all of the details related to this topic. Thank you so much.
And Katie, please.
Yes, thank you. And in terms of the disease, in terms of the impact of COVID-19 itself, in terms of fertility, that's an active area of many of the areas that are under study at the moment with research ongoing. There are many things that we're continuing to learn about the disease itself, both in terms of the acute phase of the disease and, of course, in terms of the longer-term consequences on people's health. So we're reviewing all of this data and all of this research, and please keep in touch with our WHO guidelines for any updates when we have an opportunity to provide them. Thank you.
And thanks very much, Katie. I'm actually going to return to Athens and the regional director to say maybe a few words about support to Georgia, which was the first part, your first question as well, and with regard to access to vaccines in Georgia. Of Georgia. Regional Director.
Thank you, Rob. I thought to add the element that this morning there was the phone call between the WHO Director General, Dr. Tedros, and the Prime Minister of Georgia to see whether the WHO can facilitate in more vaccines before the COVAX further kicks in. So Dr. Tedros is linking also the Prime Minister with the CEOs of the companies. And also our office is approaching, not only for Georgia, other countries as well, to see whether we can help with bilateral donations to bridge until the COVAX kicks in. So it's very high on the radar, and thanks again to Greece also for putting the issue of the solidarity from the EU on the top of the agenda.
Thank you very much. And I'm just going to check. Ketavan Kardava, special correspondent with Georgian TV Imedi in Brussels. Ketavan, I think you had a question as well, but are you online with us? No, it doesn't seem you are. Okay, I think we've lost you. My apologies. So next, I'm going to go over to the Observer Times of India and Ashvin Bashingi. Ashvin, welcome back. Please, the floor is yours.
Thank you for considering my question. Till date, WHO bringing together government and private sector and academia. Is there needfulness of global compact for global infectious diseases which allow countries or groups to institutionalize their relation with the other countries? Can global compact for infectious disease give key benefits to drive innovation and program in 4 core areas such that information and knowledge sharing, basic science, drug and vaccine development, and best laboratory and regulatory practices? Thank you.
Thanks very much. I'll direct that first to the regional director, and then I will go over to Katie Smallwood. Thank you.
Thank you, Ashvin, for this point. Now, whether it's a compact or something differently, definitely one of the main lessons taken away from the COVID-19 pandemic is that we can only get out of this together. Referring not globally, but to the pan-European region, as I mentioned couple of times at the press briefing too, is that I established the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics, to come up ultimately with targeted, focused recommendations on investments in health and social care. And the commission is chaired by Professor Mario Monti and released a couple of weeks ago its call to action, preliminary results. And one of the recommendations of this independent commission, is not a WHO commission, is to have at the global level a international board, an international intergovernmental panel on screening health threats, which ultimately could become a health board. This is number one. And number two, another recommendation of the Commission, preliminary, was to have a pan-European Center of Disease Control. And this is in addition, of course, to the global movements which are happening through the independent panel on pandemic preparedness and review and the IHR Emergency Review Committee. But definitely much more collaboration for better preparedness is something that we need to see, and not only on COVID-19, but on many other parallel pandemics, including, for example, the HIV/AIDS, where still we are in search of a very good vaccine. Thank you.
Katie, would you like to add to that?
Thank you very much, and not much to add on what the regional director has just described, but of course the global treaty that has been announced and supported by many member states will add to the list of existing international frameworks that we have for innovating, building preparedness, fostering collaboration between member states and institutions, and of course always building on the international health regulations, and then other existing frameworks for other pandemic-prone diseases, such as the pandemic influenza preparedness framework, and also the R&D blueprint, which is housed within WHO, which really identifies the next disease X and identifies for that disease, whatever it may be, what are the major gaps in terms of research and development that exist, and fosters collaboration in those areas. So absolutely all of these things are involved and in progress in parallel. Thank you.
Thanks very much, Katie, and thank you, Regional Director. I was about to wrap up, but I can see that Gunilla van Hol is back with us. Gunilla, Is that an old hand that you're raising or a new hand? Gunilla? No.
Yes, it's a new hand. Sorry.
Okay, please go ahead.
Thanks for allowing me to ask a second question. It is about death rates. As you said, they're decreasing. They're still high in many countries in Europe, though. The Nordic countries seem to be an exception here. They have come down with the death rates dramatically, even Sweden. Would you have an idea what the reason is, and how concerned are you about other countries that still have a high death rate, like Italy, France, and Greece? Thanks.
Thanks very much. I'm going to go across to Katie for that. Thank you, Gunilla.
Thank you, Gunilla. And I think in general, in the Nordic countries, we've seen relatively low incidence in the past few months, although all of the Nordic countries have had recent surges in cases that they've responded to. As a rule, if we look at Norway, Sweden, Denmark, Norway, Denmark, Finland, Iceland, of course, they've brought case incidence down very, very low, and or significantly lower than the average in the European region. And that means that overall the quality of care given to patients that are hospitalized tends to be higher, just because of the lower burden on intensive care units or on hospital beds, and the ability of the quality of care to be given means that the case fatality rate will be higher. In terms of why those death or mortality rates have remained low, given the increases in other areas such as case incidence and in other groups, high rates of vaccination in those particularly